Hi, this is Dr. Nguyen from Feeding Beyond in Hackettstown, New Jersey. So the following video, you're going to see the patient testimonial of her 1-year follow-up.
I never had any idea at how important the feet are.
Yeah.
What led me here was out of pain and fear. I'm retired now. So my activities where I were on the feet a long time is going to the mall, enjoying shopping, the shopping that's needed, going to buy the food at the supermarket, trying to follow the growing up grandchildren with their sports activities. That's things that you want to do and feel you have to do to survive. But all of that was painful.
It was painful. I remember when we first talked about doing something about this, that there's a lot of fear factor because you concerned about your age,
Yes.
concerned about how long it's going to heal, right?
Yes, yes.
And you did great. And we did it in the office. No sedation.
I didn't have any pain during the procedure. I had no fear because a doctor had explained every step of what was going to happen that day, and indeed the healing after that day, and so nurtured during the time. There was a call every day for about 2 or 3 days to ask how I was doing at home, and home was fine because it was all bandaged up and I was sent home. I am so grateful, and I have not had any pain, any problems. I've had no infections. Just beautiful.
Yeah, the initial issues is that Christine big toe have a big callus on below underneath the big toe.
That is true.
And it keeps breaking down on the skin, even though that she doesn't have diabetes, but it's still a concern as like her skin break down. And that is actually create a lot of pain when any shoes that she was wearing. It did like create that pressure in that area. That's the first thing. The second thing, her second toe have a one of those contracted but also deviation on the toe itself. So that curvature keep pressure against the big toe, and that skin around that area also break down. And as Christine saying that sometimes she had to put a band-aid around there just to give offloading that area. But at the point that we just it's beyond what we can do conservatively.
Oh yes.
Right.
And in fact, the big toe was stepping over
the
second toe.
And we did corrections on the big toe and the second toe, and a few months later, everything healed up so nicely.
Yeah.
And we realized the remaining toes will become very bending and curling. Right?
The last 3 toes.
Yes.
They were pitiful. We have a reborn foot.
And look at the shoes that she's wearing right now, which is what she not be able to wear before.
Oh no, and
like this kind of shoes, like she not be able to wear before. Now she can.
It is wonderful. Thank you.
Yes, absolutely.
You're really just a genius, and I thank you for all the years of going to school and learning how to do this, because it is wonderful. Doesn't matter what tiresome questions that I may have had, I was always answered in a way that I could understand, and felt very comfortable and courteous in speaking with me. And then that went through when you finally do come in with your appointment to see the doctor, and it went the same way all the way along. You were never felt or never spoken to with a nurse or the doctor with their hand on the doorknob indicating body language that I gotta, not at all. It was never like that. In my heart, that they become sort of part of your family. I mean, it's still a professional relationship, but it's just very comfortable. And you say, how have you been? How is your family? Have you had any problems with the COVID? It's like that. It's not like you come in and just look at my feet and thank you. There's other conversation that goes on too.
And that is what the vision of what Dr. Zhu and I, we try to create when we start opening our practice, because we've been to see doctors as well. We still need to see doctors.
That's right.
So we kind of like pick and choose on how the directions, how our vision would like to complete the care for the patient. You treat people like the way that you like to be treated. So if that's something that I be able to translate it out to take care of my patients, same thing like Dr. Zhu would be able to carry that out, then that's what we do. That's why we've been in the practice for 16 years, and we have patient like you recommend family and friends, and like come to see us, and that is very important to us, and that's how we grow.
Well, I think that for me, um, I detect that and I feel that, and it comes over very sincerely and very strongly.
Mm-hmm.
And I thank you.
Mm-hmm.
I thank you because it's made a very big difference in my daily walk, and I am most grateful.
Yeah.
And I know that there are many other patients that have to feel the same way, because that's the way that it is.
I think that I'm just very happy with your progress. I mean,
Thank you
your
so
progress
much.
from the start is like phenomenal.
Yeah, thank you.
With so many concerns, we before the procedure, and then we be able to get you healed properly.
Oh yes.
Get your foot walking, and it's not impact your daily activities anymore.
Oh
And
no.
that is the key for why we did what
Yeah.
we did, and what we do every day. So I'm very happy with your progress.
I am too. When you go home from surgery and when doctor wants to see you in a few days, 4 or 5 days later, and so on, this has all been wrapped in a special way, keeping the toe in the position that doctor wants it, and so on. And then at some point, you are required to do this at home. And Dr. Wren, she goes over this point by point and very thoroughly. And if you want to, you can write it down on a piece of paper, two bandages around there, and then bring it over the big toe. And a suggestion was made. And this is how Dr. Wren, in her heart and kindness, gives of her time. And working here, they are busy. The thing was that I was going to come in with my adult daughter because she's the one who has a smartphone. But I just have a little flip up thing, doesn't do texting or anything like that. But daughter, with Dr. Wren, took a video on her cell phone of Dr. Wren doing the rewrapping on the toe. Can you imagine? So that when I did this at home, I just looked on Jackie's telephone and could do it. And so that's above and beyond caring and kindness. And thank you. That moved my heart.
Yes.
When you helped us with that.
Yes. So sometimes that we do things every day, but we don't know how important to some patients. And for you to share that is very meant a lot to me. Yeah. And I'm sure that Dr. Zhu feel the same way. Thank you for that.
You have been talking to Christine Weiser, and Dr. Wren has restored my feet.
To find out more about minimally invasive foot treatment, contact Feet and Beyond at 908 576 0880 or visit feetandbeyond.com.